Hi, you guys. Welcome back for our daily practice questions. It is day 100, and as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, one on one sessions, and more to assist with nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. And this week is the last week to enroll in the upcoming 5 week review that starts on April 21st. There is one spot still remaining. If you're looking to join, click the link in the description. All right, you guys, question number one. A 35-year-old female presents to the clinic reporting low mood, fatigue, and difficulty sleeping for the past 3 weeks. She also describes a loss of interest in hobbies she used to enjoy, a 6 pound weight loss without trying, and trouble concentrating at work. She denies any suicidal ideation. Which of the following best reflects the most likely diagnosis? Is it A, generalized anxiety disorder, B, adjustment disorder with depressed mood, C, major depressive disorder, or D, bipolar disorder? Take a moment and tell me what you got in the comments, y'all. So, I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, which of the following best reflects the most likely diagnosis? And I always say, if they're looking for a diagnosis, you got to run it back and look at those assessment findings. What are their signs and symptoms? How are they presenting? What is their chief complaint? What is noted on exam, right? So we have a 35-year-old female who presents to the clinic with low mood, fatigue, and difficulty sleeping for the past 3 weeks. She described loss of interest in hobbies. She has a 6 pound weight loss without trying and trouble concentrating at work. No suicidal ideations. Y'all, this is classic for C, major depressive disorder. Remember, it is classified as major depressive disorder if they have these signs and symptoms for greater than 2 weeks. 3 weeks was the key here. Okay, so C is your best answer. Question number two. All right, so question number two states a 50-year-old male presents with symptoms suggestive of depression, including low energy, insomnia, and feelings of worthlessness. As an NP, which of the following tools is most appropriate to help you screen and assess the severity of his depressive symptoms? Is it A, GAD-7? Is it B, PHQ-9? Is it C, the Beck Anxiety Inventory? Or D, MMSE, the mini mental status exam? Take a moment to tell me what you got, y'all. Tell me what you got in the comments. All right, so stemming the question here states, as an MP, which of the following tools is most appropriate to help you screen and assess the severity of his depressive symptoms? So this is why stem of the questions are so important, because this is specifically telling you what we need to pay attention to. What screening tool allows you to assess the severity of depressive symptoms? B is your best answer. A PHQ-9 is utilized for that. You know, GAD-7 is a generalized anxiety disorder assessment tool. Beck Anxiety Works on Assessment and Mini Mental Status Exam. That's a cognitive exam commonly utilized for people for like assessment for dementia and things of that nature. So even in scenarios where you're not exactly sure, you can rule out what you do know, right? So pay attention to those key identifiers and terms, because if it's telling you anxiety, and GAD is the acronym for generalized anxiety disorder, but we're assessing the severity of depressive symptoms, pay attention, rule those things out. All right, question number three. A 28-year-old patient has just been diagnosed with major depressive disorder. She is hesitant about starting medication but is open to treatment. What is the most appropriate first-line treatment approach you should discuss with her? Is it A, prescribe an SSRI and refer to psych immediately? B, initiate cognitive behavioral therapy alone and monitor closely? C, prescribe a mood stabilizer and recommend exercise? Or D, recommend exercise and follow up in 3 months? Take a moment and tell me what you got, y'all. All right, so stem of the question here, what is the most appropriate first line treatment approach you should discuss with her? All right, so when we're talking about a treatment, I always say look to see if they have provided you with a diagnosis, because in the event that they have not, you need to run it back and look at the assessment findings, right? So you can determine a diagnosis, because we got to know what it is to be able to treat it. So here it does provide us saying that she was diagnosed with major depressive disorder. So what is the first line therapy for major depressive disorder? SSRIs, right? So your best answer is A. You want to prescribe an SSRI, but you also want to make sure you refer out to Psych for further management. Remember what we do, y'all. I know that a lot of us have worked in various areas in nursing, but as the provider, you got to focus on what is your scope. And although we can manage and treat, you need to refer to their specialty to take over the full evaluation and treatment of this, okay? And even if wherever you plan to practice allows a certain overlap for testing purposes, you refer. You're not doing this in the office, right? Remember, boards is a perfect world. All right, you guys, I hope you found this helpful. As always, please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Everything that I do offer is linked in the bio of this channel. And if you're looking to book any of my one-on-one sessions, any of my custom packages or plans, or any of my question analysis sessions, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.